Today will be an opportunity for all of us to learn more about type 1 diabetes mellitus in children.
Type 1 diabetes is a chronic condition characterized by the immune system mistakenly attacking and destroying insulin-producing cells in the pancreas. Dr. Albert Kamgisha at China-Uganda Friendship Hospital, Naguru, explores some of the complications children with type 1 diabetes face.
The common complications that we see in a child with diabetes is one, if they are not on treatment, their blood sugars will go very high. And when their blood sugars go very high, they get these symptoms I've mentioned. They pass a lot of urine, they are always thirsty, they are losing weight, they become weaker and weaker, and they can get other problems in the body. But these are the common ones. Yeah.
He advocates for skilling these children with training to take care of themselves as a way to better their lives.
One of the things that us, the health workers, do is to skill the child with the family so that they know how to manage their disease, know how to monitor the disease, how to detect problems, and when to come to the hospital when they see those problems, how to adjust their doses, what to eat, how to take part in physical activities like games, exercise, how to take part safely. So we take them through a comprehensive program over time, how to do this, and that is what we call diabetes self-management, how to get the child and a young person be able to manage their disease with more or less a supervisory role in our side, the health professionals.
Mark Mwesiga, the Executive Director, Palliative Care Association of Uganda, appeals to all palliative care providers to interest themselves in knowing much information about such chronic diseases such that they can provide good care to the patients.
It's an appeal to palliative care providers across the country to make sure that they get interested in caring for children who have diabetes, because as you saw, as we were being told today, the children are across the country, and because there is not much awareness, some of the children are not being diagnosed early to start treatment and to make sure that they can live and they can have the facilities.
Depression and stigma, according to Chisembo Emmanuel, who has also lived with type 1 diabetes for 11 years, are some of the biggest challenges faced by children with this chronic condition.
I'm a person living with type 1 diabetes. I've had it for 11 years now. I am a warrior, and in our world we say warriors are children living with type 1 diabetes that live with great courage and who are an inspiration to the others. Some of the challenges that children with type 1 diabetes live with are depression, because it is ever present. You're always diabetic, so it has a toll on your mental health. It's always present. It requires you to take injections. It may the community is not so much aware about diabetes, so there is some stigma around it. People fear to come out and say that they are diabetic because of the myths that surround type 1 diabetes. We've met many children who are treated for malaria, typhoid. Others are taken to witch doctors because they believe they are bewitched. They don't know type 1 diabetes.
He adds that one way to end stigma against children with type 1 diabetes is creating awareness of its existence.
The best way to fight stigma is to raise awareness. If you're in a community and people know what you are, I feel that you're better embraced. The more you keep it to yourself, the more it takes its toll on you. You understand? So you need to speak out. It's not easy to come out and speak, but if you can, you need to speak out. We need to raise awareness in schools. People need to know about diabetes. I see HIV clubs. I see other clubs, but we need to diabetes. People should know that a child can be diabetic. There are other types of diabetes that even children can get. So I believe that if there is sensitization, if there is awareness, it will help reduce on the stigma. It will take away these myths that people think that people who are diabetic, the children are bewitched. They may think that maybe they ate a lot of sugar, they brought it upon themselves. No.
Unlike type 2 diabetes, which is often linked to lifestyle factors, type 1 diabetes typically manifests in childhood or adolescence, requiring a lifelong commitment to insulin therapy. Managing this condition involves a delicate balance of insulin administration, monitoring blood sugar levels, and making lifestyle adjustments.